and I must tell them, Ani Bagouzian, Miss Marwa from Kuwait, and Milad Sheidei, Dr. Milad Sheidei, Dr. Haidarji Ramandi, and Mrs. Zahra Alizadeh from Iran. All my teammates had done a lot of collaboration with me, and I appreciate them at the first two. And for next slide, I must talk around it, please. As I told, thyroid hormones were recognized as one of the most important regulatory hormones and modulate every component of the metabolic pathways. Thyroid hyperthyroidism and is characterized by the presence of anti-thyroid antibodies, and autoimmune thyroid disease are common organ-specific autoimmune disorders, mostly seen in women 30 to 50 years old. It occurs due to loss of tolerance to, for example, some for example, peroxides like as TPO or triglobulin, TG, or thyroid stimulating hormones receptor like as TSHR, which leads to the inflammations of the glands. Okay, thyroid peroxidase or TPO is a membrane-bound enzyme which plays a crucial role in thyroid maybe hormone synthesis and iodinations and successive coupling of tyrosine residence, catalyzed by TPO, finally results in T3 and T4 production, had shown us, for example, these results too. Inadequate immunological response against TPO and triggers and maybe the onset of autoimmune thyroid diseases, ADTP, for example, had shown these results again too. Not only doses of anti-TPO induce antibody medicate or, for example, the mediations of the cytotoxicity between them too, but it also contributes to complement cascades of activation and is probably able to directly inhibit TPO activity consequently. If I be honest with you, thyroid cell damage as well as direct enzyme blocking may lead to insufficient hormone productions, occasionally pretended, or for example, it was just followed by transient hypothyroidism, or both hypothyroidism of 2 to 4% of women and 1% in men are affected with this autoimmune thyroid disease, or for example, TD, or as a better abbreviation, I must tell AITD. In iodine exposure may cause goiter, hypo or hyperthyroidism, and thyroid autoimmunity, for example, thyroiditis, or the name as Hashimoto, that was originated from Japan, and some diseases like as that are well known consequently of this AITD, and other conditions due to AITD induce atrophic autoimmune hyperthyroidism, and some parts of them associated, for example, these disorders, although this AITD occur in only 1% of population, and subclinical and focal thyroidism and circulating between anti-thyroid antibodies may be found in 15% of subjects. In addition, elevated titers of anti-TPO were revealed in a wide range of diseases affecting various body organs, that including Bemers, maybe precursor anemia, that was, for example, one of the most and main part, and some hepatitis that treated with INF alpha, systematic lupus, and some other disorders that we can name. Absolutely, the breast cancer and diabetes completely were affected by this factor, and moreover, relationships between anti-TPO and other obstetric complications such as postpartum thyroiditis or depressions of after labor are well known too. Okay, next slide, could you? In this slide, I've tried to show that how you can find some relationship between our brain and some metabolisms. As you know, biochemistry and the biochemical reactions in our body completely will play a very main and so important role of our body. As you know, thyroid gland as interface, or better that I can tell and name it as a conveyor or vector between the brain and other metabolism, can play very extensive roles of our body. And we've tried to tell that our brain health and our neurological health completely can make various duties or roles in brain, or maybe the heart, or completely in the women, some reproductive hormones too. As you can see here, increased metabolism, or for example, some bone formations, or some proteins, maybe formations or characteristics of them too, can make a lot of roles and the main factor or features for our topic in this slide. And next slide, please. We must tell about importance of anti-TPO. As you know, elevated titers of anti-TPO that I've told you were revealed in a wide range of diseases affecting various body organs that I told, including blemishes, okay, pernicious anemia that I said, and viral hepatitis treated with INF that you know that was completely and mainly related to our liver, and maybe systematic lupus that maybe in like our for example diabetes, or with the levels of insulin in our body, or something like as that, and mellitus breast cancer, and something like as that, thyroid nodule disease can be affected by this disorder too. And moreover, relationships between anti-TPO and maybe obstetric complications such as postpartum thyroids or depressions after labor that I told can be other very important and remarkable things that I can tell around anti-TPO. And next slide, please. In our research, I should tell in this cross-section study, 500 cases of the laboratory of Isfahan where included anti-TPO antibody was measured using enzyme-linked for example, sorbent assay or ELISA methods. And some of them for TSH, T3, and T4 were measured and analyzed between enzymatic linked immunoassay or ELISA methods. And determinations in the following ranges were considered normal: T3 equal to 0.9 to 3.2, T4 50 to 170, uh, 0.3 square, and change it, please.
Hey, sorry, we lost your audio for a second. You said next slide? Okay. Okay, Mr. Ebrahim, we don't have your audio.
Do you hear me? Do you hear me now?
Yes, we can hear you now.
Oh, okay. In our result in the present study, the serum, okay, concentrations of anti-TPO, T3, T4, and TSH were measured in 500 individuals belonging to areas of Isfahan, center of Iran, as you know. And the main, I should
Okay, we don't have your audio again. I'm sorry. Okay, Mr. Ebrahim, if you can hear me, we don't have your audio.
I was a solution, and the main. Can you hear me?
Yes, we can hear you now.
Okay. It was aimed to see the impacts of age, gender, and climate on the anti-TPO, T4, T3, and TSH levels. The normal hormones levels are different for different genders, and the age-wide distributions of study subjects for the determination of thyroid hormones that I've told you, like TSH, T4, and T3, plus anti-TPO levels, is shown in some tables that you can see, and I will talk around that maybe in other results if you let me. The next slide. Okay. Firstly, I must tell that, for example, it's almost clear from the data in, for example, the table 1 that I've put here, the serum value for T3 is significantly lower in female 1.50 and in male 2.17. In the age more than 80 years old, and in, for example, other table, we try to show the serum of T4 value increases significantly in female 117 and for male 111.21 for example in the 5th decades of life, then decreased significantly in female 95.50 more than the, for example, the male 122, and in the age groups having more than 80 years old, as you know, for example, whenever we wanted to analyze them, for example, the range of the ages and genders, we found that if you add some ranges of the people, we can find upper and maybe more remarkable levels of anti-TPO and maybe the hormones. And completely they illustrated the data in, for example, other tables that showed us serum TSH value significantly higher in females, 3.63, that is clear. And for example, in male, that was 2.65. And in the second decades of their life, with the sudden drop, that was very clear. In the 4th decade, for example, with high significant decreases in female, 2.72, that we tried to analyze them. And after that, we found that that was increasing significantly in females, 9.25. That is very remarked. And as you know, for example, suddenly we found that in male that was 1.35 in different groups, and they were having more than, for example, other parts, and especially for 80 years old, that was clear too. While the provided data in other table revealed that there were significant increases in serum anti-TPO values again too in females in the 1st and 2nd decades of their life. And we could tell completely around other parts. If you change the slide, I can tell more about them. Just I could put some special tables and a special, I don't know, the figures for them. If you change it, yeah, I told about them too. And next slide, please. Dear doctor, could you change it? For our discussion, as I told you, iodine deficiency and related disorders were very common in Iran prior to 1996. That is very maybe the poor data of Iran that we couldn't find from 2 decades. Okay, absolutely, in 2 decades we couldn't find any normal data of all general hospitals of Iran, but we've tried to compare them, but our past ones, when organizations or USI Iran pregnancy disorders as one of the, for example, remarked and main part that we must consider more, is almost 2 times more than the level recommended by the WHO. In countries where iodine deficiency maybe there is not present, autoimmunity is thought to be the main cause of thyroid disease, from hyperthyroidism to, for example, other features like, for example, elevated levels of anti-TPO and anti-TG antibodies are mainly associated with thyroid autoimmune disease and thyroid cancers, but low concentrations are also found in normal maybe individuals. Thyroid antibody is secreted in a for example, or dominant manners, and it's seen more in young women and relatives of autoimmune thyroid disease or AITD patients. In our study, we found maybe elevated levels of anti-TPO in 17% of females and 25% of male with normal TSH levels that I showed you in table. And the T3 levels in male was found to be, for example, elevated, and maybe that was increased, which was followed by a drop. Then it was increased too in the later decades. And this pattern of effects is also in agreement with the findings of previous workers or some other research, while in case of females, it's remained nearly consistent in first few decades of life, with a little decrease of value in the last decades of life. And many studies have suggested, at the end of my talking, I should tell, many studies have suggested that estrogen may overlap the thyroid hormones action. These data taken together indicate that age-dependent, for example, depletions of estrogen may contribute to be progressions of resistance to be, for example, these hormones or the actions of these hormones in females. Thus or so during for example, some normal human lifespan, serum T3 is maybe in the lower level at the time of birth, and increase of, for example, some parts in during early infancy remains high during childhood, and it was reduced after adolescence, then remains stable until late middle age, and ultimately decrease in old ages. Thanks a lot for hearing me. If you have any questions, I can talk around that. And in this part, you can see hyper, for example, thyroidism completely rely on for example, hypothalamus, and the other ones that you can see, free T4 and TSH, can be exchanged with thyroid, and this metabolism can show that if we control and try to consider on one of them, we can control other factors too. And the next slide, if you show us discussion. I told around this discussion, yes, and in our conclusion, I must tell. And for our conclusion at the end, it can be concluded from the present study that the age, gender, race, and maybe the area all have some very changeable effects on the levels of T4, T3, TSH, and anti-TPO. And a major conclusion drawn from the present study is the both serum in TSH and anti-TPO analysis are maybe vital for the diagnosis of both autoimmune hyperthyroidism and subclinical hyperthyroidism, for example, factors in some patients that we want to analyze them. Also, we need further studies to discover the link between anti-TPO and maybe cancer, especially in women. We at the end of my talking, before appreciation of my old colleagues and co-workers that they had helped us a lot, and they have been following all our research. I must tell that we can control a lot of women cancer with the hormone control, absolutely, for anti-TPO and TSH and T3 and TSH, T3 and T4, especially for their breast cancer. I think all our drugs and maybe some supplements in our nutrition must be changed, and we unknowingly are trying affecting our a lot of disorders in future life. Thanks a lot for hearing me. If you have any questions, I can